Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Monday, March 9th, episode 25. And today's thread runs through the corridors of power. The UN just assembled its first ever independent AI science panel. $1 billion statistical framework for disasters got endorsed this morning. And the Philippines is pushing Southeast Asia toward a unified disaster response architecture. Governance Week is here. We'll start at the top of the UN system. On March 3rd, the United Nations convened the inaugural meeting of its independent International Scientific Panel on Artificial Intelligence, a 40-member expert body established by the General Assembly to provide scientific guidance on global AI governance. Nobel Laureate Maria Ressa has been selected as one of 2 co-chairs.
This is the closest thing we've seen to an IPCC model for AI. The panel is mandated to produce annual evidence-based assessments of how AI is actually shaping economies and societies, and it operates independently, meaning no government, no company, and not even the UN itself can direct its findings.
Secretary General Guterres put it plainly, the world urgently needs a shared global understanding of artificial intelligence, grounded not in ideology, but in science. He also warned the panel is in what he called a race against time, pointing out that AI is accelerating so fast that, quote, never in the future will we move as slow as we are moving now.
For practitioners, here's why this matters operationally. This panel's assessments are likely to anchor what major donors and UN procurement systems call responsible AI. If you're deploying AI in health, displacement, or disaster settings, the frameworks this body produces in 2026 and 2027 will almost certainly show up in compliance requirements and grant conditions. Start tracking its outputs now.
First report expected later this year. Worth watching. Moving to something that landed this morning, the 57th session of the United Nations Statistical Commission endorsed the Global Disaster-Related Statistics Framework, or GDRSF. It's the first comprehensive global statistical framework to standardize how disaster data is defined, compiled, and used in national statistical systems.
This is foundational infrastructure. The framework brings together national statistical offices with national disaster management agencies under a shared data architecture, standardizing how countries record deaths, injuries, displacement, infrastructure damage, ecosystem losses, and economic costs from disasters. It also tracks disaster risk reduction expenditures, making prevention investments visible in national accounts for the first time.
For AI developers building early warning systems or needs assessment tools, here's the signal. This framework will eventually become the reference standard for cross-border AI models. Countries will be reporting under GDRSF, and tools that can't ingest or align with that schema will face adoption barriers. If your data architecture doesn't reflect it, now's the time to start adjusting.
Think of it like FHIR for disaster data, the standard that makes the whole ecosystem interoperable.
Exactly right. Now to the Horn of Africa, where the situation in Somalia is deteriorating fast. An estimated 6.5 million people are in acute food insecurity as prolonged drought continues, and a flash alert from this week puts 180,000 civilians newly displaced. The Red Cross issued an alarm this week. Oxfam reported that Somalia's 2026 humanitarian response plan has secured only 13.4% of required funding, and water costs in the worst-hit areas have surged by 2,000%.
And then this came in on March 7th. Somalia's National Disaster Management Agency confirmed that the United States has informed the government it should not expect U.S. drug relief assistance this year. That's a significant funding gap landing on top of an already severely underfunded operation.
From a practitioner standpoint, 13.4% funded at this point in the year is a procurement emergency signal. For any organization operating in East Africa, this means activating alternative funding channels, tightening unit costs, and prioritizing the highest need clusters. If you have AI-driven needs targeting tools or cash transfer optimization systems, this is exactly the scenario they were built for.
And it connects to the USAID withdrawal picture we've been tracking, where organizations that built their delivery models around U.S. bilateral funding are now having to rebuild at the worst possible time.
Now to a funding story that offers a concrete pathway. The Evidence for AI and Health Initiative, EVA, officially opened for proposals today. It's backed by Wellcome Trust, the Gates Foundation, and the Novo Nordisk Foundation with a combined $60 million pool.
The target is specific: AI-enabled clinical decision support tools already in use by frontline health workers in sub-Saharan Africa, South Asia, and Southeast Asia. And the mandate is to close a striking evidence gap.
Of 86 randomized clinical trials on AI health tools conducted globally between 2018 and 2023, only 4 took place in low and middle income countries. Only 4.
That gap matters because governments in these regions cannot confidently adopt or scale tools that haven't been tested in their own clinical environments, languages, and workflows. Promising tools stall at proof of concept. EVA's 2 pathways address this directly. Pathway A offers up to $1 million for 3 to 12 months of early deployment evaluation, usability, safety, cost-effectiveness. Pathway B offers up to $3 million for 12 to 24 months to measure actual health outcomes at scale.
Critical requirement: proposals must be led by organizations registered and operational in eligible regions, with at least 80% of funds flowing to regional entities. If your organization is already deploying AI tools in these settings, this is the evidence funding to apply for. The link is through JPAL at MIT. Check the ICT Works piece from this morning.
Now to a story that speaks directly to the recovery phase of the disaster management cycle. The International Rescue Committee published a detailed report this week on 2 years of AI deployment lessons through its Signpost platform. Signpost has served more than 20 million people since 2015, operating across approximately 30 countries, connecting crisis-affected populations to social workers and trusted information.
The headline numbers: AI tools met quality standards roughly 75% of the time and increased staff productivity by nearly 70%. But, and this is the critical lesson, they still required human review before responses could be shared safely with people in crisis.
Which means the productivity gains are real, but the accountability architecture has to be in place first. The IRC's core finding is that responsible AI in humanitarian contexts is an operational discipline, not a slogan. It depends on infrastructure, low bandwidth compatibility, multilingual capability, the ability to audit outputs and override the system when necessary.
For organizations evaluating AI tools for information services or beneficiary communication, these numbers are a usable benchmark. If your system performs below 75% quality, you're in the red. If you've removed human review from the pipeline, you're taking on accountability risk that donors and audit bodies are increasingly flagging.
Southeast Asia before we go. The Philippines, currently holding the ASEAN chairmanship, is pushing for adoption of a regional disaster response framework before its chairmanship ends this year. The Department of Social Welfare and Development is leading the effort to establish coordinated response architecture across all ASEAN member states, targeting food security and disaster readiness as joint priorities.
The timing matters. Indonesia is dealing with active flooding right now. EU ECHO issued a flash alert this morning for severe weather and landslides. Southeast Asia's vulnerability to transboundary disasters, typhoons, floods, haze emergencies, makes regional coordination not just useful, but essential.
For technology developers in the region, an adopted ASEAN disaster framework would mean binding coordination obligations and shared resource pools for 680 million people. That's an eventual regulatory environment to design for, and a procurement opportunity, because governments will need interoperable systems to meet their commitments.
Practitioners should watch for the framework adoption timeline before the ASEAN chairmanship transfer.
Before we close, events this week and ahead. The Humanitarian Networks and Partnerships Week's face-to-face sessions begin tomorrow in Geneva, running through March 12th at the CICG. AI and humanitarian response is on the agenda. The Humanitarian Leadership Academy is running sessions on local leadership in AI development. If you're in Geneva, get in the room.
The WSIS prizes deadline is March 15th. That's 6 days from now. World Summit on the Information Society prizes are among the most visible global recognition mechanisms for AI and ICT for development. If you have a project worth nominating, this is your window.
NVIDIA GTC runs March 17th through 21 in San Jose and virtually. And for those planning ahead, the Everything AI Governance event at the UN House in Brussels is May 13th to 14, with applications due April 18th. That's Impact Signals for Monday, March 9th, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.